Red alert signs of pneumonia in babies. Recognizing red alert signs matters, because pneumonia can transition from a standard lung infection to a life-threatening medical emergency in a matter of hours. When these specific signs appear, they indicate that the body's compensatory mechanisms are failing and vital organs are being deprived of oxygen. According to global health organizations like UNICEF, pneumonia remains the leading infectious killer of young children worldwide. Yet the vast majority of these deaths are entirely preventable with timely treatment. Red alert signs are not a cue to schedule a doctor's appointment, they are a definitive signal to go straight to the emergency room. Now, let's discuss the red alert signs of pneumonia in babies. In infants, red alert signs of pneumonia can look very different from adults, because babies cannot communicate their discomfort. Seek immediate emergency medical care if an infant exhibits any of the following critical warning signs. Chest retractions. The skin pulls sharply inward between, below, or above the ribs, when the baby breathes. Chest retractions in babies occur when the skin sinks in around the ribs, collarbone, or sternum during inhalation. This is a key sign that the baby is struggling to breathe, and is using extra muscles to draw air into their lungs, thus making it look like they are sucking in their chest. Tachypnea, extremely fast breathing. Tachypnea in a baby is a respiratory rate greater than 60 breaths per minute. Normal infant breathing ranges from 40 to 60 breaths per minute. If your baby breathes extremely fast, monitor for signs of distress. You can count this by watching their stomach rise and fall while they are resting. Grunting sounds. An audible lure or groaning noise every time the baby exhales, which is their way of trying to keep their airways open. In babies with pneumonia, grunting is an involuntary sound made when exhaling. It is a compensatory mechanism where the baby pushes air out against a partially closed vocal cord to keep the airways and small air sacs in the lungs open. Grunting indicates moderate to severe respiratory distress. Nasal flaring. The nostrils widen significantly with every single breath as they struggle to pull in more air. Nasal flaring in a baby with pneumonia is a physical sign that their nostrils are widening to take in more air, indicating they are working too hard to breathe. It is a critical warning sign of moderate to severe respiratory distress that requires immediate medical attention. Head bobbing. Head bobbing in a baby with pneumonia is a critical red flag indicating severe respiratory distress. It means the infant is working exceptionally hard to breathe and is using extra muscles in their neck and chest, signaling that they are tiring out and need immediate emergency medical attention. Central cyanosis. A bluish or pale gray tint specifically around the lips, tongue, or mouth, showing dangerously low blood oxygen. Central cyanosis in a baby with pneumonia is a serious warning sign, indicating severe hypoxemia, dangerously low oxygen levels in the blood. It occurs when fluid and inflammation from the infection block oxygen exchange in the lungs, causing an accumulation of deoxygenated blood. That turns the lips, tongue, and gums a bluish-gray color. Lethargy or floppiness. The infant is abnormally weak, unresponsive, cannot be easily woken up, or feels unusually limp in your arms. Inability to feed. The baby is too weak or breathless to suck, completely refusing to breastfeed or drink from a bottle. An inability to feed in a baby with pneumonia is a serious warning sign. It indicates the baby is experiencing severe respiratory distress or is becoming too exhausted to breathe and eat at the same time. This requires immediate emergency medical attention. Fever in newborns. Any fever of 100.4 degrees Fahrenheit, 38 degrees Celsius, or higher in a baby under 3 months old is considered a standalone emergency.